breast augmentation is a procedure that enlarges your breast. So most commonly, we do that with the use of implants, breast implants, which can be silicone, the majority of them, or saline breast implants as well. Some of the augmentations can be done with your own tissue, such as fat. So a fat grafting is an acceptable way to enlarge breasts, although maybe not as dramatically as what you can achieve with a implant. Anybody that has a nice shape and form to their breast and want to enlarge the size, let's say they fit into an A cup size and they want to go to a D cup size, that would be the only way to achieve that would be really with implants. If you were to try to do that with your own fat, you would need quite a bit of fat and more than one episode of surgery to achieve that enlargement. So that's why we resort mostly to silicone breast implants. And the question arises, are silicone breast implants safe implants? And as a matter of fact, they are. In 2006, they were approved for general use by the FDA. And I've been doing a lot of breast augmentation with silicone breast implants, and the great majority of patients are greatly satisfied with that procedure. There's a small number of patients that do have problems with them. Most of them are aesthetic problems. Let's say the breast doesn't look the same after gaining weight, losing weight, or having children, and patient would like to have, in addition to an implant exchange, a lift, something that corrects the shape and form of the breast to match the shape and form of the implant, so you get the best possible aesthetic results. In the year 2006, after 14 years of scrutiny and research, silicone breast implants were brought back to market. And they have been used ever since then. And they're very safe to be used. And but there's a couple of problems that are very concerned about nowadays. And particularly the FDA has required the manufacturers to elaborate a disclaimer that every patient has to read and sign, and I have to co-sign as well. And it's related to two things that are very important. One is the breast implant illness, or breast implant associated illness, which is a disease that is not very qualified or concretely specified, because it presents in different manners, and patients have different symptoms, different constellation of symptoms, and some of those symptoms are fairly vague. For instance, brain fog is one of them, weight loss or weight gain, loss of hair, fatigue is a very common sign. Intense research is being done in the subject to try to qualify or figure out exactly what is going on with those patients. Luckily, they are a very few minority of patients, and some of them have come through my office and I've removed the implants, making those patients feel better. So there is a way to correct this problem, which is to remove the implants. How much needs to be removed, whether there's a need for a capsulectomy or an en bloc resection, those are things that are still controversial. And I think it's very important for the doctor and patient to figure out exactly what is it that we need to do to improve those symptoms. The majority of these patients have had extensive medical workups with no results at all. So everything seems to be normal, but the patient knows that they don't feel normal anymore. So most of the time, we opt for removing the implants because everything else has been tried. The other issue is the ALCL, or BII-ALCL, which is an anaplastic large cell lymphoma. It's a very rare malignancy that presents in some patients that have long-standing breast implants, particularly silicone breast implants and particularly texturized breast implants. So much that Allergan makers of the natural implants remove from the market some of those implants that have the texturization that is most aggressive. Blepharoplasty is the scientific name for the eyelid tuck. So when we start aging, one of the first places where we show the aging process is in the eyelids, upper and lower eyelids. Most commonly, we start with excess of skin in the upper eyelids, and then to follow, we'll develop that bags under the eyelids. Too much work, too little sleep, too many worries. That all reflects in your face. So when people start showing these signs of aging, they look tired, and they're tired of being asked, why are you tired? Why are you mad? When they're not. So the blepharoplasty corrects that excess of skin, opens up your eyes, gives you a more alert look. It's something that it's okay to do at an early age. Most of the time, people that manifest this is because there's a family trait. It's something that happens in families. They remember that their father had their eyes done, and grandpa had their eyes nearly closed with excess of skin, and things like that. So typically, it's a family trait, and it appears early in life, in your late 30s, 40s, and so on. Luckily, it's a pretty simple operation, and it renders very nice results. And it changes completely the attitude of the patient and the competence of the patient. So the patient feels much more confident and show up their face. And especially for women that apply makeup, they're able to put the makeup on and enhance their eye look tremendously. Eyelid surgery is very popular and it's very rewarding, especially for people that develop early on these signs of aging. So, for instance, the upper eyelids are very easy to correct, and sometimes we do that here in the office under local anesthesia. Sometimes we use the nitrous oxide inhalation. Sometimes we use medication like a Valium and a Percocet. And it's very easy to recover from. And I use absorbable sutures so we don't have to remove them. They're not going to feel sick and they don't have to be in bed or anything like that. You can go on with your normal life, but it's not going to look pretty for about a week or two. So you want to stay home, relax, and as things heal, and then you're going to start looking good at about a month later. The lower eyelids are a little bit more involved, so I use a regular operating room to deal with them, and they're a little bit more involved in terms of how much you can remove and things like that. People ask me a lot about fat grafting. And the truth is that when I was doing my residency in 1904, we used to not think much about fat grafting. As a matter of fact, it was something that was considered temporary and just a filler that would go away eventually. But it was thanks to Dr. Sidney Coleman in New York that we all learned how to do fat grafting the right way. And it's an incredible operation that helps out in many, many ways. Fat grafting can help out with scars. It can help out with aesthetic procedures. For instance, very, very commonly when I do a facelift, I would use fat grafting to enhance the volume. Because with aging, we lose a lot of volume, and that's what makes the skin sag. So when you tighten the skin, put it back where it should be, then you still have that loss of volume on the face. And fat grafting is the ideal way to restore that lost volume. And it's amazing the amount of rejuvenation that you get by restoring volume with fat. Fat also, as a cellular graft, has the ability to induce improvements in the quality of the skin. That's why it's used very commonly in reconstruction. Well, the fat grafting surgery is something that is done generally with another surgery. For instance, you're doing a tummy tuck and you want to enhance the buttocks, so you take the fat from the tummy and put it in the buttocks. So that's one surgery. Now, sometimes we're going to restore breast volume and there's no really good donor sides. So we sometimes look at the arms, and sometimes the arms are a good source of fat. The trick is that fat has to be harvested in a certain way and has to be re-injected in another specific way to ensure the maximum take of the graft or function of the graft. The fat usually takes in about 60 to 70%, sometimes more, sometimes less. And that's what you should expect for a result. Now, how long does it take to recover from that? It depends on the associated treatment that you're doing at the same time. For instance, the other day, yes, I had a patient of mine who I had removed her implants and did some fat grafting, but she wanted more. And in cases like that, you have to see whether the patient has good sources of fat, because you don't want to over resect or take too much fat from the donor side and cause a problem in another place to fix this place. That's not good. That's not good medicine. So you have to always be very selective of your donor sides so you don't cause any additional problems. Risks from fat grafting. Yes, there's definitely risk associated to fat grafting when it's done improperly. And this is something that has transpired in the past in other countries and also in our country, particularly in the area of Florida, where fat grafting has been done not following the correct procedure that needs to be done. And fat can be very dangerous when injected into the circulatory system, particularly into the veins, and it goes to the lungs and produces thrombus there, or fat emboli, which is could and can be a deadly problem. Now, the ASPS, the American Society of Plastic Surgery, had appointed an ad hoc committee to study these problems of fat grafting to the buttocks that migrate to the circulatory system. And they've concluded that injecting fat into the buttock muscles is very dangerous because it can easily break the veins in between the muscles and migrate into the circulatory system or bloodstream. So there are some recommended ways of doing the fat grafting, and one is to use a large cannula and use vibration and inject it only in the subcutaneous tissue. Never try to inject into the muscles. And we've seen that allows for a safe use of fat grafting. Oftentimes I hear my patients, when I tell them, okay, you're a very good candidate for fat grafting, they go, but isn't that dangerous, doctor? And the answer is yes, it can be very dangerous when done improperly in untrained hands. I have never had a patient that developed such a complication as intravascular injection of fat. And I've used a lot of fat grafting in the face, in the breast, and in the buttock areas. One of the very important applications of fat grafting is for breast reconstruction after cancer, because a lot of the patients that have breast cancer receive radiation to the breast, and that changes the tissues permanently. So the skin becomes very hard and pale, and it looks burned. Now with fat grafting, you can manage to change the biology of the skin in a reconstructed area and make it soft again so it looks and feels like a normal breast. It's amazing what it can do. Now for cosmetic uses, I use it a lot in the face, as I said, in order to restore volume. You can use it in hands to cover those tendon and veiny looking hands of old people. And another place I use it is for breast corrections. I don't do reconstructions in general. I do a lot of cosmetic breast surgery. And sometimes we have adverse results. Sometimes we have asymmetries to correct. And sometimes we want to get rid of old implants and restore some of the volume loss from that. For all those reasons, I love to use fat grafting because it's your own tissue, it's live tissue, and when it takes in place, it functions as a rejuvenating agent. One of the very important uses of fat is in body contouring, especially people that have tummy tucks done at the same time. You can use all that fat harvested from the abdomen and from the upper and lower back and use it to enhance the contour of buttocks. So buttock enhancements are done with fat grafting in a very satisfactory way. So fat grafting to me is almost miraculous, all the things you can do with it. Facelifts are very nice procedures that enhance the beauty of a patient tremendously. Typically in the late 40s and early 50s is when patients start noticing that sagging of the skin, particularly in the jawline, the formation of jowls, and with excess of skin and sometimes fat in the neck area. All of that coupled with a loss of volume on the cheek area that makes that skin sag even more. And the facelift addresses all that. So the facelift addresses the lower 2/3 of the face, and from the upper third, we consider that a brow lift, which some people consider as a part of a facelift, but in reality is a different operation. So when a patient is in the right height to weight proportion, and it's nice and active and athletic and things like that, that makes the ideal patient for rejuvenation. So restoring the anatomy in this part of the face, which includes the jawline, the jowls, and the excess of skin in the neck, has a tremendous impact on the way people judge their age. So it's amazing, but you subconsciously are kind of assessing people's ages by the way they look in this area. And you can see that with photographic evidence of patients before and after facelifts that show the dramatic improvement when you modify that area. Facelift is a pretty long operation. It takes me about 5 hours to do. And the care is done on an outpatient basis. We use a compression dressing at the end of the procedure, and the patient is seen in the office the next day to tell them how to do the care of the incisions and things like that. The recovery takes about a week and a half to 2 weeks to feel normal, but socially you're not going to be presentable for a good 3 to 4 weeks. So you have to take into account that, and if you have any big events, you don't want to do a facelift too close to that event. You give yourself a month or so or more, because more is better. Hello and welcome to my CoolSculpting studio. Today we're going to talk about this equipment, the CoolSculpting, what it is, and the new edition of the CoolSculpting Elite, which I'm here very proud to present to you. CoolSculpting is a non-invasive treatment for excessive fat or unwanted fat. What it does is it can contour some of the extra fat you may find in your body without the need of surgery, which is amazing. And it works by a process called the cryolipolysis or cryolipolysis. What it essentially means is with the use of cold temperature, we can dissolve or neutralize some fat and therefore contour some areas of unwanted fat. Broadly, is anybody that has an isolated area of excess of fat that can be pinched, can be grabbed, and because sometimes you have folds that are pure skin and that wouldn't respond very well. So it treats mostly the underlying fat that you can pinch in certain areas where you can attach an applicator and treat it. On the flip side, who is not a good candidate for CoolSculpting, and that would be somebody with overall excess of fat and obesity that cannot be treated adequately, and people that have a lot of redundant skin, like for instance after massive weight loss. So when the problem is the skin, obviously it's not going to be corrected with CoolSculpting. Basically, the applicator will chill the area of fat to a certain temperature, and the temperature is somewhere between where the fat congeals and when the water congeals or becomes solid. So if you can keep it within that margin of temperature, the fat cells are very sensitive to the fat inside them to congeal, so they burst and disappear. In average, they say that CoolSculpting will eliminate 25% of your fat cells in a certain area, which is what makes a difference in terms of contour. So what I'm showing you here is an applicator. So this is the piece, and there's several different applicators for different places in your body. And what I want to show you is that this cavity is where the fatty tissue is going to be fitted into, and this is where the chilling will occur. And you're connected to this for about 45 minutes or sometimes less with the new technology. And then after it's disconnected, you need to have an intense massage in the area, which could be quite uncomfortable, but it's not necessarily painful. It's just that we need to restore the circulation in the area so the process will continue favorably. Every fat cell that bursts because their fat is congealed will go away forever. We do have a limited number of fat cells in our body, and unless you increase your weight significantly, the number of fat cells stays about the same. Once the fat cells are eliminated with the process of CoolSculpting, they will never come back. However, that doesn't keep people from being able to gain weight and enlarge that area again with the current fat cells in place. So it requires that the patient that has the CoolSculpting maintains a reasonable amount of weight over time, so the results will stay in place. The truth is that CoolSculpting is not a weight reduction process or treatment. So the amount of fat that is eliminated, like I said before, is about 25% of fat cells. That probably wouldn't have much of an impact on the scale. So CoolSculpting is just a contouring process. It's not a weight reduction process. The CoolSculpting takes approximately 45 minutes per application. So you should consider spending a good 2 hours in the process of getting ready, getting connected, doing the process of CoolSculpting, the massage that follows that is essential for good results, and then the time that you can go back home. The downtime is nothing. I have done this procedure several times, and you feel discomfort and you feel the area probably swollen for about a week, or sometimes more, sometimes less. And then after that, you don't notice anything until you start noticing the results. That happen in about 4 weeks or so. You notice the area starts becoming smaller and thinner, and that's when you get excited about it. CoolSculpting is a very benign procedure. It really doesn't lead to any serious complications or problems, but sometimes there's some side effects, and mostly has to do with the application process and the area where it has been applied, which can experience some swelling and also tenderness for about a week or so. People generally ask me, when is the right time to do CoolSculpting when you have plans for vacations or summertime and things like that? And the answer for that is that CoolSculpting is done in sessions, and we generally advise you to do at least 2 sessions to see a result that is acceptable. Sometimes we need more sessions, and we separate those sessions about 6 weeks apart. So you need to consider, start your process probably 2 to 3 months before the summertime or any planned vacation. Well, today I want to introduce to you Britt Horton, who is our technology expert in CoolSculpting. She has been trained in the traditional CoolSculpting as well as in the new elite CoolSculpting. She has attended the CoolSculpting University and is geared to get her master's in that training. She is here to help you decide and treat the areas that are of concern.
I am excited for this new technology and to map you out a personalized plan for your new CoolSculpting journey.
Looking for a non-surgical way to restore volume, smooth wrinkles, and enhance facial features? Injectable fillers might be the perfect solution. These gel-like substances, typically made of hyaluronic acid, are carefully injected beneath the skin to add volume and reduce signs of aging. The procedure is quick, typically taking under 30 minutes, and results can last anywhere from 6 months to 2 years, depending on the type of filler used. Premier offers a variety of dermal fillers, and our providers will help you determine which one is best for you based on your specific needs. Whether you're looking for subtle rejuvenation or more defined facial contours, fillers offer a safe, effective, and customizable way to enhance your natural beauty.
Hi, I'm Danielle. I'm a nurse practitioner here at Premier, and today I'm going to talk about Cyton's Halo laser. Halo is Cyton's first hybrid fractional laser that can be used on all skin types. Halo combines ablative and non-ablative wavelengths to offer amazing results with minimal downtime, lasting approximately 5 to 7 days. The ablative lasers work by removing the top layer of the skin, while non-ablative lasers work by heating up the underlying skin tissue while not harming the surface. With the Halo treatment, you will see a dramatic reduction in sunspots, fine lines, wrinkles, skin dullness, and more. It is a complete skin revitalization treatment. It works by triggering your body's natural healing response while revealing that luminous glow that you had at a younger age. With Halo, you will accomplish ablative results with non-ablative downtime. Today we're going to talk about hormone replacement therapy. This is a treatment used to restore hormonal balance. We do this by supplementing hormones such as testosterone, estrogen, and progesterone. This therapy is commonly used to alleviate symptoms caused by hormone imbalances such as those related to menopause, low testosterone levels, or certain medical conditions. The goal is to provide relief of symptoms such as mood swings, low libido, fatigue, and more. We do this by utilizing bioidentical hormone pellets as well as other supplementation. Restoring hormonal equilibrium can also have long-term benefits for overall health, such as reducing the risk of osteoporosis and heart disease. Hormone pellets are about the size of a grain of rice, and they are inserted by using a small incision, and they are placed with minimal pain and downtime. Pellet placement for women can last approximately 4 months, and for men approximately 6 months. Each individual's needs and response to treatment may vary, so personalized care is crucial in achieving the best possible results for overall well-being.
SkinPen is an FDA-approved microneedling device that makes micro-injuries into the skin at a tailored depth to target acne scarring. The downtime with SkinPen is very minimal, maybe 1 day of downtime with some true redness on your face. But the next morning, you're usually good to go about your regular normal routine.
Are you looking for a powerful, non-surgical way to tighten skin, reduce wrinkles, and improve texture? Vivace RF microneedling combines the benefits of microneedling with radio frequency energy to stimulate collagen production and rejuvenate your skin from within. This advanced treatment creates tiny micro-injuries while delivering heat deep into the skin, triggering natural healing and boosting collagen and elastin. The result? Firmer, smoother, and more youthful-looking skin with minimal downtime. Vivace is ideal for fine lines, acne scars, enlarged pores, and overall skin tightening, delivering noticeable results with little discomfort. If you're ready for a glowing, lifted, and more youthful complexion, book a Vivace RF microneedling consultation today. Our providers here at Premier are ready to help you turn back time.
Healthy skin is firm, it is taut, it is hydrated, normal in color, even in tone, and it is tolerant and free from disease, such as rosacea or acne. If you have problems with hyperpigmentation, acne, or just dullness of your skin, these are all things we can address here at Premier OKC.
Hi, I'm Danielle. I'm a nurse practitioner here at Premier, and today I'm going to talk about Cyton's Halo laser. Halo is Cyton's first hybrid fractional laser that can be used on all skin types. Halo combines ablative and non-ablative wavelengths to offer amazing results with minimal downtime, lasting approximately 5 to 7 days. The ablative lasers work by removing the top layer of the skin, while non-ablative lasers work by heating up the underlying skin tissue while not harming the surface. With the Halo treatment, you will see a dramatic reduction in sunspots, fine lines, wrinkles, skin dullness, and more. It is a complete skin revitalization treatment. It works by triggering your body's natural healing response while revealing that luminous glow that you had at a younger age. With Halo, you will accomplish ablative results with non-ablative downtime.
This neurotoxin is peptide driven and with proper dosing can last you up to 4 to 5 months duration, attached to the cell membrane more efficiently, and helps the neurotoxin complex stay attached to the cell. Daxxify uses peptides instead of proteins, therefore, we may have longer results.
Hi, my name's Danielle and I'm a nurse practitioner here at Premier OKC, and today we're going to talk about PRP, also known as platelet-rich plasma. PRP is a topical or injectable treatment that uses a person's own blood. Once your blood is drawn, it goes through a special cleaning and separation process in order to separate out the platelet-rich plasma. Growth factors are released from the plasma, which in turn amplifies the healing process when used as new collagen begins to develop. This has been shown to provide an overall rejuvenating effect on the skin's appearance. It's great for improving skin texture, fine lines and wrinkles, and increasing volume and more. It can be used alone or in conjunction with many other treatments.
BBL is one of the most sought after devices for people looking to treat sunspots, age spots, rosacea, acne, visible vessels, and so much more. This non-invasive treatment uses powerful broadband light to gently heat the skin's surface and intentionally trigger your body's natural healing ability. In turn, your body will produce more natural collagen and elastin, helping firm the skin and decrease the appearance of wrinkles. It is recommended to receive 3 or 4 treatments, plus maintenance treatments to keep the skin healthy, and therefore your results.
Hi, I'm Danielle and I'm a nurse practitioner here at Premier, and today I'm going to talk to you about Botox Cosmetic. Botox is a neuromodulator that works by temporarily blocking nerve signals to muscles, causing them to relax. Botox Cosmetic is approved for over 30 therapeutic and aesthetic uses worldwide. This would include the moderate to severe frown lines between the eyebrows, crow's feet, and forehead lines. These are common areas where wrinkles and fine lines tend to develop due to repetitive facial movements, expressions, and aging. One of the remarkable aspects of Botox Cosmetic is its relatively quick onset of action. While individual results may vary, many patients may begin to see improvements within 1 to 2 days after treatment, with the full effect typically becoming apparent within 1 month. The duration of Botox Cosmetic's effects is generally around 4 months, although this can vary from person to person. Regular maintenance treatments are often recommended to sustain the desired results over time.
Chemical peels work in a variety of different ways depending on their strength. Our lunchtime peel or our stimulator peel by Zia, dullness of the skin, these are a really great peel option, but they are so beneficial.
Today we're going to talk about our medical weight loss program. Our medical weight loss program offers a comprehensive approach to help each individual achieve their weight loss goals. We provide you with a personalized plan, GLP-1 injectable medications, as well as dietary and lifestyle guidance. Our team works closely with each patient to provide ongoing support. We do this while ensuring an approach to weight loss that is sustainable.
DiamondGlow facials are non-invasive medical grade facials that use a diamond grit bit that helps extract, exfoliate, and infuse a customized serum based on your skin's needs. This procedure isn't painful. It's a quick 30-45 minute procedure, and you can expect almost immediate improvement in your skin's appearance.
Are you hoping for more radiant skin with a lasting glow? Skin Vive by Juvederm is the first and only hyaluronic acid microdroplet injectable designed to improve skin hydration, texture, and elasticity. Unlike traditional fillers, Skin Vive enhances your skin's overall quality rather than adding volume. This innovative treatment boosts hydration from within, reducing fine lines and giving your skin a refreshed, dewy appearance. The procedure is quick with little to no downtime, and results can last up to 6 months, perfect for those wanting a natural, healthy glow. Skin Vive is ideal for all skin types and works beautifully alongside other aesthetic treatments. For radiant, hydrated skin that lasts, Skin Vive is the ultimate skin-boosting solution. Book an appointment with one of our providers at Premier to refresh your look with Skin Vive.
These are tiny, naturally occurring vesicles, messenger cells, and these exosomes go to our damaged cells and revive them and help reduce. Topical exosomes can be paired with almost any in-office treatment. Another alternative to Botox, it is still compromised of botulinum toxin type A and protein bound. It is comprised of a small molecule, so it tends to have a wider spread and even distribution. This laser is a non-ablative laser that targets uneven skin tone, texture, pigmentation, and fine lines and wrinkles by stimulating collagen and elastin through heated channels in the skin, or even just a little prejuvenation for the skin. With MOXI being non-ablative, that means your downtime for this procedure is very minimal. For optimal results, we recommend 3 MOXI treatments for a corrective series.
Want to restore youthful volume and improve skin texture naturally? Sculptra might be the perfect solution. Unlike traditional fillers, Sculptra is a biostimulatory injectable made of poly-L-lactic acid. It works by stimulating your body's natural collagen production, gradually restoring lost volume and improving skin elasticity over time. Sculptra is ideal for treating hollow areas, softening deep wrinkles, and enhancing facial contours with results that appear gradually and can last up to 2 years or more. The treatment is minimally invasive with little downtime, making it a great option for those seeking long-lasting, natural-looking rejuvenation. For a refreshed, youthful look that builds over time, Sculptra is a powerful collagen-boosting solution. Book a consultation with one of our providers at Premier to determine if Sculptra is right for you.